Hey everyone, this is Paul from Ortho Eval Pal. I want to talk a little bit about exercise-induced compartment syndrome. I have with me Jake. Jake is 20 years old and he has to take this basically physical test in order to get into the Border Patrol, and has to be able to run about 1.5 miles, but having difficulty getting there because of some shin pain and difficulty with leg weakness after he gets to running. So we've got him started here on the treadmill, and one of the things I like to do when I test people for exercise-induced compartment syndrome, I'm listening to the sound of their foot slap when they're on the treadmill, okay? So I'm just gonna pause for a second. I'm gonna have you listen to the slap. And then we're gonna take a little break in a bit. We're gonna let him run and we'll see how far he gets. Then we're gonna assess that noise or that foot slap again, okay? So he's been having difficulty running. He has no problem stationary biking, so that doesn't cause any issues. And he's also been quite active. He does a lot of walking. That does not seem to bother him. This is mostly on the right side more than the left, but he does get this on the left side also. And he's gone through a very conservative course of physical therapy, working aggressively on glute strengthening, changing some of his biomechanics, working on hip flexor mobility, gastrocsoleus mobility. He barely had 0 degrees of dorsiflexion when he first started, and 5 weeks later still having trouble. So we're consulting with an orthopedic surgeon and considering possibly some releases to his anterior compartments. But just want to show you what this looks like as he gets going. How you doing so far?
Not bad.
All right, okay. So we're gonna take a little pause, and then as he gets a little further into this, we'll talk about what things are looking like. We'll have him take his shoes off and we'll take a peek at his legs. Thanks. Hey everyone, so now we're about 6.5 minutes into this, and as you can hear, the right side is slapping a lot more than the left side. He's having a hard time controlling his dorsiflexion. So he also has orthotics. He's wearing compression socks, and we've done all of the biomechanical stuff, soft tissue modalities and whatnot to help treat this. So having a hard time? Yep. He's feeling like things are locking up in the leg. Not really a lot of numbness at this point, but really he was saying that it's starting to get stiff and starting to get full. And so we're just going to give him a little bit longer, and then we're going to take a look at his legs once he gets off. So probably around the 7.5 minute mark right now.
Yep.
And the gait is getting a little sloppy also, as you can see. A lot less control. He's not dorsiflexing as much on this side here. So what we're going to do is, when we get him stopped, we're going to quickly put him onto a table. We're going to have him take his shoes and socks off. We're going to assess his feet, check out his strength, and see what he looks like. So if you want to hold for a second, we're going to transition over to a table and get him checked out.
As far as that's going up.
All right, so first thing we're going to check is his range of motion. So can you lift this foot up for me? So before the run, he could lift it all the way up here. Okay, now hold it there. Don't let me push it down. Okay, I can collapse him really easy. All right, now I want you to relax. And do you have any pain with that?
It's tight.
Tight up here? Okay, now I'm going to palpate him here. And this is really, really hard, okay? Like when I first checked him out before the run, this was very soft, okay? And now he's developing a significant tightness right in that anterior tibial region, okay? I'm going to check his pulses also. He still has some good color to his feet, so I'm not worried about any sort of arterial occlusion. Good there. Great pulse there. Good there. Good here. Can you lift this foot up? Hold tight. So he's got weakness there. Hold this one up. This one's significantly weaker. Now explain to me what you're feeling.
This one's just, it feels full, I guess. Like I can't lift up my toes or anything.
Okay. Now, when you typically get this, how long does it take to recover when you stop your run?
Anywhere from like 15 minutes.
Okay.
Around that.
Yep. And just resting helps it, and it feels better after that.
Yeah,
okay.
Probably a few minutes from now, it'll be back to normal.
Yeah. So we've given a really good, strong, conservative course of treatment. We've put him into orthotics to help to prevent the medial arch from collapsing so much, and so that his anterior tib wouldn't work so hard eccentrically. We talked to him about sneakers because we know that a harder soled sneaker will cause him to foot slap faster and eccentrically load the anterior tib more. So we've talked about that, tried different shoes, tried the whole shoot and match. It's really not responding. So we'll be discussing this with an orthopedist soon about a possible release so we can get Jake back to running and back to function. But still having a lot of tightness, and it's already been just about a minute and a half. So we're going to give him some rest. We're going to let him recover. And, that is our video on exercise-induced compartment syndrome. This is more chronic in nature. He's had this for a while. If this was an acute situation where he was struck in the leg and developed this, those are the types of folks that you want to have at the hospital or to a specialist right away, because sometimes those require surgery just to decompress the area so there isn't nerve damage and damage to some of the blood vessels going down into the foot and ankle region. So I hope you liked today's video. If you did, give us a thumbs up and be sure to subscribe. Thanks.